And so far, 38,945 people have been discharged, while 1,002 people have died from COVID-19 complications since the pandemic began. Joining me now is a public health physician and Dr. Maimuna Kadiri. Dr. Kadiri, it's good to have you join us right now. Now,
thank you.
Earlier we got projections of the fact that sub-Saharan Africa will witness some of the worst COVID-19 fatalities. In fact, some predictions were that they were going to pick bodies on the streets. But we haven't seen that situation yet. Some physicians are explaining that it could be the possibility of the prevalence of malaria, where chloroquine and related drugs have been administered over the past decades. Could this be part of the explanation you see?
Yeah, the truth is that is one of the theories that is being postulated, and of course several other theories with regards to what we eat, our skin color, we having more sunshine. So there are several theories that have been, that we are all looking into. But the truth is that, everything has to still be based on scientific studies, and now we're verified. So that at the end of the day, it won't just be assumption, but we're properly documented. So that for future references, for future pandemics, that can be used as, these theories can now be used as reference points to it.
All right. Despite how many, several months of COVID-19, we still hear people saying that they don't believe that COVID-19 exists. Now, a lot of people are turning their attention to those who have survived COVID-19 to come out one way or the other and let the people know that they had survived it as a way of creating more awareness. Do you think that's a way to go?
It's a very good way to go with regards to that. So there are major form emotional issues that come through with COVID-19, which we narrow them to FADs. FAD meaning fear, anxiety, denial or doubt, and then stigma. So what is making people not to come out? The stigma attached to COVID-19 survivors. So by the time we start seeing people, especially notable people in our society, coming out, discussing their day-to-day, issues when they were either in isolation or home-based care, I think that will also sensitize people to talk about their own stories, knowing fully well worldwide, over 85% of COVID-19 cases do recover. So I think that is a very good step for people to just come share their story. It doesn't really mean, the fact that you had COVID-19, you are going to die tomorrow. You survived it. That is why it's called COVID-19 survivor. So talking about it makes a lot of sense, especially high people. Like, for example, the commissioner, this morning was announced. If he tells us at the end of the 14 days how things went with him, how he, what he did, what he went through, a lot of people will identify with him. So we do encourage that for people to come and talk about it. If we can all look at it, that look, this is a death sentence, that will reduce the stigma attached to COVID-19 survivors.
All right. One other thing a lot of persons are talking about is the issue of enforcement. The PTF, Presidential Task Force, and even the NCDC have all expressed their frustration with people not abiding by the health protocols that were on and the guidelines. Some people are calling for subtle enforcement. I wonder what you make of this.
The truth is that let's look at the economy of the country. We are really not there. On Saturday, I was in a panel discussion with His Royal Highness, the former CBN Governor, Sanusi Lamido Sanusi, and was rolling out all the indices on what we should look at now and of course post-COVID-19, and it was making so much sense. The truth is that going back to another lockdown may not really make a lot of sense, but what we can really do is to just abide to the government directives. I said earlier on, we have 4 emotions that are driving us in: denial and doubt. People are seeing a lot of denial, people are seeing a lot of doubt. If we can just adhere to the protocols by wearing face masks if you have to go out, washing your hands regularly with soap and water, hydrating yourself, practicing physical distancing, community transmission that we are seeing now will really reduce. And we have been blessed in a way that all the propaganda or all the things that they said it will happen to us in Nigeria are not happening. So, but just do the basic things. The hand washing, the physical distancing, avoiding crowd, wearing face mask. Is that too much for us to just adhere to? I think we just need to change our attitude towards the COVID-19 viral global pandemic.
All right. A change of attitude is everything right now. Thank you very much, Dr. Maimuna Kediri, for your time. We appreciate you.
Thank you too.
Great.